A 41-year-old mom caught a cold. Taking just one vitamin supplement caused her kidneys to stop working completely. This is her story. KL is a 41-year-old woman presenting to the emergency department at the University Medical Center with confusion, headache, abdominal pain, and respiratory problems. Her daughter tells the admitting nurse that she has vomited several times during the last few hours. She also denied any recent travel and told the nurse that her mom was not taking any medication. But when the doctors checked KL kidney function, they found out that her creatinine level was 10.1 milligrams per DL. What this means is that her kidneys were almost not working anymore, and there was only one way to save her life. She had to undergo emergency dialysis immediately. Today, we are going to see what happened to her kidneys when she took just one vitamin. Catherine here. I've been working with kidney disease patients for almost 10 years now, and there is always a lot to learn from cases like that of KL. Today's video is based on a real story, a case study actually, published in the Chest Journal in 2000. This is a new format for me, guys, so please let me know in comment section if you like this kind of videos and if you want to see more like this one. And the reason why today I'm showing you the story of KL is because there is a very important lesson to learn from her. You see, today's marketing is pushing the sale of supplements that are way more dangerous than people realize. Vitamins are no exception. If we take a look at what Amazon.com and other supplement stores have to offer vitamin-wise, we may see a large number of vitamin brands selling dosage too high to be safe for anyone. And it's one of the most used vitamins that cause KL kidneys to stop working. But the doctors didn't know which one. She was admitted in the state of confusion, and they had to perform several tests to find out which vitamin was causing her kidneys to fail. According to her daughter, KL started to develop a respiratory problem about 2 weeks ago. She told the doctors that she saw KL vomiting several times during the last 3 days. She also remembered seeing her mom taking pills, which was unusual for her, but she didn't know what the content of those pills was. We now know that KL was worried for her health and for her job. 2 weeks ago, she started to develop a sore throat, followed by persistent symptoms of respiratory problems. She was concerned that she might have caught the flu, so she took high doses of a certain vitamin. It didn't seem to work because she quickly started to get a fever. She was getting busy at work and couldn't afford to be sick, so she brought more vitamin bottles and massively upped her dosage. About 4 days after increasing the dosage, KL went out for dinner and started to feel stomach pain. After passing some watery movements, she thought that she had some kind of food poisoning, so she went home and drank some water and didn't eat or drink for the rest of the day because she simply wasn't hungry or thirsty. Interestingly enough, she didn't have to use the bathroom for the next 24 hours. So the big question the doctor needs to answer now is, what happened to KL kidneys when she started to take one vitamin? Doctors had to start a series of tests to find out which vitamin damaged her kidneys. What they found after a renal biopsy is that acute tubular necrosis and massive oxalate deposition were present in her kidneys. The vitamin KL was taking is a water-soluble vitamin. This means that when someone takes too much of it, the body will remove the excess through the urine. However, if the dose is really high, like in the case of KL, during the breakdown of this vitamin, one very dangerous substance is formed. Oxalate. Oxalate typically exists in your body via urine. However, under some circumstances, oxalate may bind to minerals and form crystals that can lead to the formation of kidney stones. Have you ever heard about calcium oxalate kidney stones? This is exactly what happened to KL kidneys. The levels of oxalate were so high that large oxalate crystal depositions were formed in her kidneys, completely shutting them down. But it was too late to do anything now. Her only hope was dialysis. The patient underwent 2 sessions of hemodialysis, but after learning what vitamin caused all of KL troubles, the doctors were worried. While this vitamin is generally regarded as safe, there are various documented cases of people ending up in the ER due to the misuse of this vitamin. What you see here is a different case study. This man took the same vitamin as KL and he lost his life. Okay, which vitamin caused KL's kidney failure? So have you guessed which vitamin in very high doses causes calcium oxalate deposition in the kidneys, kidney stones, and also diarrhea, nausea, and vomiting? I'll give you a hint. This is actually the most commonly supplemented vitamin in the world. It's also very useful and many kidney disease patients are recommended to take it even in a much smaller dose than what KL was taking before ending up in the emergency room. So which vitamin are we talking about? If you know the answer, please write it down in comment section. Yes, the vitamin that sent KL to the emergency room is vitamin C. After 2 dialysis sessions, KL started to regain consciousness. As the doctor were suspecting, she admitted to the daily use of vitamin C in large doses. She told them that to control her respiratory problem, she started to take vitamin C in large doses. At first, she was taking 500 milligrams tablets, 4 to 5 tablets daily. On further inquiry, the patient was able to recall that she had begun taking even larger numbers of vitamin C tablets a few days prior to the onset of symptoms, up to 10 tablets daily or 5,000 milligrams. Now guys, before getting back to KL's story, we will finally see if she was able to get home to her daughter safe. There is a very important question that needs an answer. Is taking vitamin C safe for someone with kidney problems? Okay, what we absolutely need to understand about vitamins is that basically any vitamin can cause serious problems when the dose is too high. Now, this is the whole point of today's video actually. I always show you the benefits of the remedies and vitamin that can be of help for someone with kidney problems. But I also always tell you the same thing. Please consult your doctor and get informed before taking this remedy. Because as we have learned, even a remedy as safe as vitamin C may be incredibly dangerous even taken in the wrong dose. So now you may ask, what is the safe dose for vitamin C supplements? The recommended daily amount for vitamin C is 75 milligrams a day for women and 90 milligrams a day for men. The upper limit for all adults is 2000 milligrams a day. Now guys, these doses are for people without kidney problems or a history of kidney stones. If you have chronic kidney disease, especially in the advanced stages, the recommended dose for vitamin C from supplements is even lower, just 60 milligrams per day. And for those with a previous history of calcium oxalate kidney stones, even this dose must be approved from a doctor. So we may understand now why taking 5000 milligrams, this is what KL was taking, of vitamin C per day is extremely dangerous. Okay, do you want to know how it ends? Did she make it? After 2 weeks in the hospital and 2 dialysis sessions, KL was able to urinate regularly again. On day 14, measurements showed a band of 40 milligrams per dl and a creatinine level of 2.2 milligrams per dl. These levels told the doctors that her kidneys were now working and the patient was discharged home with follow-up in his hometown. Guys, I hope you enjoyed this video. If you want to watch the story of a real kidney disease patient, someone who was able to beat diabetes and kidney disease, this video up here is for you. And this is all for today. Thank you for watching. God bless.